I'm Madge Thomas, and this is Powering the Movement, a Global Citizen podcast. This podcast is here to share inspiring stories from people in our movement of engaged global citizens. They live around the world and are committed to ending extreme poverty by 2030. Today, we're going to the outskirts of New Delhi, India, where young kids meet one-on-one with doctors and dentists for their routine checkups. But they're not at the doctor's office. These students aren't skipping school either. They're getting routine health checkups all from their school's campus. And all of this was at no cost to the students or their family. It's with a program called HealthSetGo.
HealthSetGo started for the benefit of children, and our sole beneficiaries for anything that we do, any program that we take, remain to be the children. And our entire program is focused and measured by us on the impact that we are having on their lives. And here we are conducting our HealthSetGo Care program, which is our flagship program that we have been doing here for the last 3 years. Today specifically, we are looking at two things. One is ensuring that we do an annual preventive medical assessment of the students, which includes the physical checkup, the dental checkup, the eye checkup, and the entire growth assessment of these kids. And this is an annual event. And apart from that, we're doing our health and hygiene curriculum today called the HealthSetGo Care Box on hygiene. So children are very excited to learn all about hand washing and what are the different steps.
That's Priya Prakash. She's the founder and CEO of HealthSetGo. Her organisation works in schools across India to educate kids on healthy habits. HealthSetGo does early interventions, like these checkups, to catch warning signs of poor health early. And the kids can tell you exactly what they did today.
My name is Shivam Chablani. I study in the Shriram Millennium School, Faridabad. There were many doctors. First, we went to the height and weight doctor. There, they measured my height and my weight. Then we went to a doctor which had a stethoscope. He checked my heart rate and he checked my ears also. Then there was a doctor which checked my teeth, and then one checked my eyes.
My name is Namya Garg and I study in the Shriram Millennium School, Faridabad in class 8A. So when I had my dental checkup, I got to know that I have one cavity. And then last year, two of my friends got to know, one of them got to know that they have weak eyes. So they had to wear specs to school. And the second one got to know that they have many cavities, so they have to visit the dentist.
Like a lot of the global citizens you'll meet in this podcast, Priya has a personal connection to this work. She's 28 now, but as a kid growing up in India, her physical and mental health really affected her life.
When I was growing up in India, which is a very food-loving country where the culture is so steeped into ensuring that there is more and even more given to the children when they're growing up, I ended up becoming extremely overweight ever since the age of 5. And throughout that time, when I was going through that struggle of having a very heavy body weight, nobody was there to really help or support me. And it wasn't a problem, I would say, until a few years later, where I really started to look in the mirror, look at my body, and realize that, hey, I don't like myself. I really don't like how I look. After that is where things started to get worse. There were many people in my class who used to bully me a lot. And these people used to call me fat, they used to call me ugly, they used to call me all kinds of names that just made me feel horrible about myself, and they made me believe that I couldn't do anything. And that's what really turned me from a child who used to get an A grade in every single examination up until that point to becoming a child who never raised her hand in class and who always got extremely bad marks in school.
By the time she'd arrived at college, Priya felt hopeless. She'd developed an unhealthy relationship with her body and she didn't know how to get better.
And this was a very emotional roller coaster ride for me. It consumed most of my time. I could not really look at myself in the mirror. I could not look at other people in the eye. And one day, I realized that I could not go on like this. I had to take ownership of my own life and I had to change. And that was really the day where my drive and motivation for finding myself started. And health was so instrumental in making me who I am today.
For Priya, her life started to change when she met a training coach at the gym. They started working together, and actually outside of HealthSetGo, she's a state-level weightlifter. How cool is that? So she wants to be that change agent for kids. She knows the impact of checkups, health, education, and preventative care. Beyond that, she knows that poor health can lead to a lifetime of poverty.
My commitment to ending extreme poverty would just be to eradicate some of the root causes that cause poverty in the first place. It's important to have healthy kids so that they can grow up to be healthy adults and they can influence the government, they can influence the workplaces, they can influence their communities, they can influence their entire ecosystem. And if that becomes a ripple effect, that can actually ensure that we have a healthier planet tomorrow. In the same city, in the same street, you'll find one of the richest people of that city and one of the poorest people of that city coexisting. And that is a reality that so many of us Indians really see every single day around us, that children are begging on the streets, they are eating out of the same rubbish piles as even animals on the street. It is so bad in our country. But when I look at it through the lens of health, specifically health, poverty has led to so much mortality with under 5 children in our country. There is maternal mortality, there is infant mortality, there is no access to medications or healthcare. And those are the people who suffer the most. They are the people who have been neglected the most.
HealthSetGo has been visiting the Sri Ram Millennium School for 3 years, and here's why its work is so important and impactful.
I'm Arsul. I'm from class 7. HealthSetGo is an amazing organization that helps us to stay healthy and fit. Their medical checkups every year helps us to know if we are getting any harmful illnesses and help us to know before they get very serious. So we get the eye checkups, nose checkups, ear checkups, and the teeth checkups. All of them are very important because they are the main portions of our body which get most affected by dust and all the bacteria and microbes.
Because HealthSetGo offers services within schools, they can reach a lot of children like Arasun, who wouldn't typically get checkups once a year.
My name is Sonali Gupta. I am the principal at the Sri Ram Millennium School, Faridabad. HealthSetGo is our health partner, and it's a wonderful initiative by Ms. Priya Prakash. The HealthSetGo makes it possible to have that checkup in school for our children, where they visit various doctors from reputed hospitals. This also helps in early diagnosis of any disease, if any. And because it is a very cost-effective program, it is absolutely wonderful for our children. All the reports go online, which makes it very easily accessible for our parents.
Seeing a doctor and dentist year after year has a huge impact on these kids.
Cumulatively, HealthSetGo has detected more than 300,000 unseen conditions in children, which means that these are conditions that weren't visible to the naked eye. And without addressing these conditions, it would have not only affected the daily quality of life, but also the long-term health of that child. So this is our most immediate impact.
HealthSetGo works with children who are as young as 1.5 all across India. This comes at a crucial time for the country. India is the 3rd most obese country in the world. Hard to believe, right? As many as 50 million Indians have type 2 diabetes. Cardiovascular diseases are the #1 cause of mortality in India.
These days, these chronic conditions are filtering down to the youth. They are filtering down to children. And these children are the ones getting type 2 diabetes, which will lead further to more chronic conditions. Today, India has the 2nd highest number of obese children. And we all know that obesity is a gateway to these chronic conditions. So, what are we doing about it? I think that is a huge question right now.
This is where HealthSetGo steps in. It teaches kids the basics of staying healthy, with the goal to prevent problems like obesity. This way, students can take control of their own health. At this school, kids learnt how to properly wash their hands. It's simple, but a very effective way to prevent the spread of germs. And most importantly, it's working.
I think the other impacts that we're really seeing with these kids are the fact that the behavior change that we so wanted is now happening in front of our eyes. Children are readily ensuring that they are hygienic, they are clean, they are washing their hands. I mean, that is a basic action, but it is a source of most of our communicable diseases. Even apart from that, we've seen schools that we work with really make huge changes to their school menu, offer healthy food, start policies in the school where parents themselves are now changing their mindset about what they should give the child or not. When it comes to junk food, their attitude towards sugar has changed, and this is very clearly reflected in a way in our medical reports. If you're healthy as a child, there is huge longevity for you. There are less disability adjusted life years. There is more quality to your life growing up.
So HealthSetGo is doing really important work, and Priya has big goals for its future. She's one of 5 finalists for Global Citizen's Cisco Youth Leader Prize, $250,000.
The Cisco Youth Leadership Prize is not only a huge global recognition, which of course is huge for a small team in India trying to work to solve this huge problem. For us, it's a lot more than that. I think we have always really wanted to get to the most backward and the most grassroots populations of our country. And the kind of financial reward that goes with the Global Citizen Prize will really help us to accelerate our mission to reach out to all socioeconomic classes in India. There are so many children who still cannot afford our services. They don't have access. We would really like within the next year to use these funds to ensure that we can create a successful and sustainable model out of ensuring that class of people in India also get these services. Because in the end, even after the recognition that we get by Global Citizen, we will have to ensure that the work goes on. And the good exposure, the kind of validation that a prize like that will give our team would obviously be extremely invaluable at the same time. HealthSetGo has just begun its journey. We have just started to impact the lives of children, and of course cumulatively till now we've impacted more than 200,000, but at the same time there are 400 million children in India, and there are so many more around the globe. And if our programs can reach out in any way possible to these children, not only in our country but also globally, I think that would be the kind of vision we have for the future.
The winner of the Cisco Youth Leadership Award is being announced this month, so you can head to our website, globalcitizen.org, to find out if HealthSetGo won. While you're there, you can check out stories about other changemakers just like Priya. To learn more about HealthSetGo, their website is healthsetgo.com. And you can start taking action to support child health today in the Global Citizen app. If you want to share Priya's story, please send this episode to a friend or help others find this podcast by rating and reviewing Powering the Movement wherever you're listening. It really helps the cause. I'm your host, Madge Thomas. Powering the Movement, a Global Citizen podcast, is a co-production of Global Citizen and Kindred Media. Danielle Roth produced this episode, and it was scored and mixed by Brad Stratton. Sandy Smolens is our executive producer. Chris Peterson is the executive producer for Kindred Media. Cassie Carruthers is the editor-in-chief for Global Citizen. Special thanks to Sandeep Singh, Chantel Simpson, and Matt Petronzio.